In 1989, a well-respected London woman named Mrs. Whitmore visited her doctor with a long list of troubling symptoms: anxiety, sleepless nights, irritability, and what she politely described as nervous episodes. Following the accepted medical practices of that time, her doctor diagnosed her with hysteria and prescribed a treatment that would instantly cost any modern physician their license. He placed her on the examination table and manually stimulated her genitals until she experienced what he clinically recorded as a hysterical paroxysm. This was not the work of a strange charlatan. This was considered standard medical practice, carried out by respected doctors in the finest clinics across Europe and America. For more than 2,000 years, physicians treated women for hysteria, an all-encompassing diagnosis believed to be caused by a wandering womb. By the Victorian era, this treatment evolved into something that today feels almost unbelievable. Doctors were literally inducing orgasms in women as a form of medical therapy, completely unaware of what they were actually doing. It is a shocking but true story of how deep Victorian sexual repression ran, so deep that doctors eventually invented the first vibrators to save their hands from exhaustion after treating hundreds of hysterical women, still without understanding the real nature of the treatment. But before we dive into how Victorian doctors turned this ancient Greek superstition into a thriving medical industry, make sure you've hit the subscribe button and turned on notifications. In the next video, I'll reveal how Victorian women were literally poisoning themselves with arsenic wafers, lead-based face paint, and mercury cosmetics just to achieve that fashionable, elegant look. Trust me, after hearing that, you'll never complain about modern makeup again. Now, let's go back to how doctors moved from believing in wandering wombs to accidentally inventing the vibrator. The idea of hysteria reaches all the way back to ancient Egypt, but it was the Greek physician Hippocrates who gave it its name. Hystera meant womb in Greek, and doctors believed that a woman's uterus could physically travel through her body, creating symptoms wherever it went. Plato described the womb as a creature within a creature, desperately longing to bear children. If a woman stayed childless for too long, her womb supposedly drifted through her body, pressing on organs and causing everything from anxiety to fainting spells. The prescribed cure was simple: marriage and pregnancy, to satisfy the restless organ. By the Renaissance, doctors abandoned the wandering womb theory, but they kept the diagnosis. And the list of symptoms attached to hysteria grew to include just about anything that troubled a woman: nervousness, insomnia, muscle spasms, shortness of breath, poor appetite, irritability, depression, sexually bold behavior, sexually repressed behavior, or simply being difficult. Essentially, if a woman wasn't perfectly obedient and content, she was probably hysterical. English physician Thomas Sydenham estimated that hysteria was the most common illness after fever, affecting 1 in 4 women. Victorian medical theory claimed that women were naturally more delicate and more nervous than men. Their reproductive system supposedly dominated their entire physiology, making them prone to physical and emotional weakness. Dr. William Acton, a prominent Victorian doctor, famously wrote in 1857 that most women, fortunately for them, were not disturbed by sexual feelings of any kind. This widespread belief, that respectable women had no sexual desires, created a massive blind spot in medicine. So when women came to doctors with what we now recognize as symptoms of sexual frustration, neither the doctor nor the patient used that term. To the doctor, it was simply illness. The treatment that developed was pelvic massage to induce a hysterical paroxysm, which we now know as an orgasm. But Victorian doctors described it in strictly clinical language. Dr. Nathaniel Highmore wrote in 1660 that the treatment caused the affected woman to experience a sudden contraction and relaxation of the muscles, accompanied by facial flushing and a feeling of relief in her symptoms. Here is how the procedure actually worked. Women visited the doctor's office, often weekly. They lay on the examination table, partially undressed but draped with a sheet for modesty. The doctor applied scented oils, usually lavender or rose, and began massaging the vulva in circular motions. Medical manuals instructed doctors to continue until the patient experienced the paroxysm, described as sudden muscle spasms, flushed skin, and heavy vaginal moisture, followed by deep relaxation. Dr. Russell Thorpe wrote in 1903 that reaching this hysterical paroxysm could take over an hour, and he complained that it was among the most tiring and demanding procedures in medicine. Doctors genuinely viewed it strictly as professional duty. In their minds, it was no more sexual than setting a broken bone. One physician wrote that treating patients with hysteria required 1 to 1.5 hours of labor from the doctor. The treatment was incredibly common. By the late 1880s, doctors estimated that up to 75% of American women suffered from hysteria. In major cities, some physicians specialized entirely in treating hysteria, seeing dozens of women each day. Dr. Taylor's practice in New York advertised complete relief from nervous exhaustion and female troubles, and employed several doctors to keep up with demand. Appointment books from the era show that women scheduled regular weekly or bi-weekly sessions, sometimes for years. Not all treatments took place in medical offices. Wealthy women could have private home visits from doctors, but one of the most popular options was hydrotherapy at specialized clinics. Hydrotherapy involved directing high-pressure streams of water onto the genitals while patients sat on specially designed chairs. European spa towns such as Bath in England and Baden-Baden in Germany became famous for their hysteria treatments. Women spent weeks taking the waters, receiving multiple treatments each day. Rachel Maines, in her groundbreaking book The Technology of Orgasm, documented exactly how these water treatments were performed. Patients would sit on chairs with cutout seats while attendants directed powerful streams of water at their genitals. The French called this the douche pelvienne, or pelvic shower. One advertisement from Baden-Baden in 1870 promised the complete restoration of female vitality through the scientific use of thermal waters. Women reported feeling rejuvenated and fully restored after courses of treatment. By the 1880s, physician Joseph Mortimer Granville faced a problem. His hands ached from treating too many hysteria patients. Manually massaging the pelvis was exhausting work, especially when some women required over an hour to reach a paroxysm. His solution, which would revolutionize hysteria treatment, was the first electric vibrator. Granville's percussor used an electric motor to produce rapid vibrations, reducing treatment time from an hour to mere minutes. Patients would sit on chairs with cutout seats while attendants directed powerful streams of water at their genitals. The French called this the douche pelvienne, or pelvic shower. One advertisement from Baden-Baden in 1870 promised the complete restoration of female vitality through the scientific use of thermal waters. Women reported feeling rejuvenated and fully restored after courses of treatment. By the 1880s, physician Joseph Mortimer Granville faced a problem. His hands ached from treating too many hysteria patients. Manually massaging the pelvis was exhausting work, especially when some women required over an hour to reach a paroxysm. His solution, which would revolutionize hysteria treatment, was the first electric vibrator. Granville's percussor used an electric motor to produce rapid vibrations, reducing treatment time from an hour to mere minutes. Although he insisted his device was intended solely for male muscular disorders, other doctors quickly adopted it for hysteria. Within a decade, dozens of vibrator models flooded the medical market. A 1906 catalog offered more than 20 different designs. Advertisements in medical journals praised their efficiency, claiming, for example, that the Chattanooga vibrator could relieve hysteria symptoms in under 10 minutes. By 1900, vibrators were the fifth most common electrical appliance in American homes, appearing in household catalogs alongside toasters and sewing machines. Sears' 1908 catalog advertised home vibrators as both practical and satisfying for domestic use. Advertisements were surprisingly explicit while remaining medically acceptable. One 1910 ad showed a woman using a vibrator on her face with the caption, "Vibration is life." The secret of centuries was revealed through vibration. Great scientists assured that not only our health but our very vitality was thanks to this miraculous force. The White Cross electric vibrator promised to deliver the essence of life itself to your doorstep. Here's the truly astonishing part: no one involved understood the sexual nature of these treatments. Doctors published detailed clinical articles on inducing hysterical paroxysms without ever linking them to sexual climax. Why? Victorian medical education completely ignored female sexuality. Textbooks taught that women's reproductive organs existed solely for procreation. The clitoris was barely mentioned, if at all, often described simply as a small vestigial organ with no real function.